Good day, everyone. I am one of the reporter of our group, and I'm going to discuss to you on what is multiple disabilities. So, multiple disability is a broad umbrella term meaning simply that the student has more than one disability. So, from the word multiple, so it is not just one disability but more than one disability. So, the specifics of this diagnosis are almost endlessly variable, and great care needs to be taken to adjust individual educational support to the child's particular needs. So we should care and have some concerns on those people who experience different disabilities, and giving them some educational support enable for them to meet their particular needs and wants in their life. So persons with multiple disability have a combination of two or more serious disabilities. For example, under cognitive, movement, and under sensory, such as mental retardation with cerebral palsy. So, what is mental retardation with cerebral palsy? So, it is one of the person who experience or having some mental disabilities, or sila yung tinatawag minsan na mga special or mga special child. So, next is we have dual sensory impairment, or deaf blindness is defined as a separate disability group. So, one of the example of the multiple disability is this kind of dual sensory impairment or deaf blindness, or sila yung mayroong mga sakit sa mata. And next is we have the causes of the multiple disabilities. But before we're going to tackle that, having multiple disabilities means that a person has more than one disability. So, what caused the disabilities? Often, no one knows. However, in some children, the cause can identify such as. So, the cause of the disabilities is we don't know if saan nanggaling, ano ang dahilan, or saan nila kinuha, or whatsoever. So, I have here some causes of disabilities or multiple disabilities, that some are came from the children, and or some are came from the parents. So, number one is we have the chromosomal abnormalities. So, this kind of disabilities is mostly came from the newborn babies, or one of the example na sakit is yung Down syndrome, or Down syndrome is yung mayroong mental disabilities ng mga bata. So, in the majority or in many cases, there is no treatment or cure for chromosomal abnormalities according to my research. So, however, genetic counseling, occupational therapy, physical therapy, and medicines may be recommended. So, enable for us to prevent this, because wala pa siyang treatment or cure for this kind of disabilities. Enable for us to prevent this, we can have counseling or different therapies, or taking some medicines. Next is we have premature birth. So, the common causes of this problem is infections and conditions such as diabetes and high blood pressure. So, this kind of multiple disabilities is yung mga bata na hindi pa nakarating sa due date ng kanilang paglabas sa sinapupunan ng kanilang ina. So, sometimes, all of the babies or some of the babies are nilalagay sa incubator, enable for them to survive. So, this kind of multiple disabilities is very serious. So mother must be careful on everything. Next, we have the difficulties after birth. So, this kind of multiple disabilities can experienced by different mothers after giving birth on their children, and most of the experiences that the mother would be difficult in is the postpartum, the blood clots, the depression, and severe headache. So this can cause or this can affect on their brain, and different infections would be encountered. So depression is very dangerous to the mother who giving birth to their child, because it will have some disabilities. So next is we have poor development of the brain or the spinal cord. So as we all know that the brain is the most important part of our body, and it is the central processing unit of our body. So if this will be affected when you were born, so you can have some multiple disabilities. So as a mother, we should be responsible and assure the safetyness and able to avoid this poor development of the brain or the spinal cord. Next, we have the infections. So this kind of the multiple, one of the causes of the multiple disabilities is the infections. So diseases caused by living organisms like viruses or bacteria. So infections can begin anywhere in our body and can spread all through it. Sometimes it can cause health problems and turn into multiple disabilities. So sometimes yung mga maliliit lang na sugat is lumalaki kapag ito ay napabayaan. And it will cause some disabilities. Next example or causes is we have the genetic disorder. So from the word genetic is sometimes it came from the genes or some genes of the parents or the relatives or some families. So this kind of disorder is maybe namana, yes, as you can see, or as you can see in the picture that I am presented on the screen is the father, and we have the father and the child, which is siguro yung ama is merong disorder at namana ito ng kanyang anak, yung kapansanan ng kanyang ama. So this kind of disabilities is minsan lang natin na ito nakikita. So maybe some of the causes of these disabilities is came from the family. Next is we have the injuries from the accident. So most of the multiple disabilities sometimes is came from the accident, and one of the injuries can be from the bone fracture, the head injury, the back injury, the traumatic brain injury, and this case can cause multiple disabilities if the incident or the accident is very serious. So we must be careful on everything or everywhere what we go. So that's all causes that I'm going to discuss to you, because there are some causes that there are some causes on the multiple disabilities, but and it will be discussed by the another reporter, or it will be discussed on the other reporter And that's all, and thank you for listening and have a good day.